Do you know your dental practice's full potential? In this video, I want to blow open your idea of what your practice can produce. And by the end, you'll know the one thing to focus on that can predictably grow your practice day in and day out. Hi, I'm Matt Kennedy, the founder of Kennedy Wealth Design and the author of the best-selling book, Untapped Wealth. I help dentists get out of the chair and get back into their life. I help them grow their practice and manage all of their assets and reduce their chair time so that their future is brighter and bigger. If you like this video, please subscribe to my channel and make sure you click on the notification bell so that you'll be notified when we post new videos. Now, many times when I talk to dentists that want to grow and I ask them their plan to grow, they start talking about wanting to do more cosmetic cases, more ortho cases, more implants, even adding sleep apnea. What they're really saying is that they believe that the path to growth is increased case size. Now, there's nothing wrong with increasing case size, but what I find is that those specialty cases are very unpredictable. I want to show you what is predictable and can lead to rapid growth, overnight growth, and can even lead to more opportunity to diagnose and do those specialty cases. Let me show you what I mean. Now, the first thing you need to understand in this scorecard is that per a 2015 survey conducted by Northwestern University and commissioned by ChrisAd, 85% of patients with jobs prefer to have their teeth cleaned before work, after work, or on weekends. Now, what's interesting is 85% of patients with jobs prefer this, which that's really our ideal patient, right? They can either have the money to pay for their dental work or they have dental insurance. And they said that for a hygiene visit, for a teeth cleaning, they would love to come in before work, after work, or weekends, but they would come back and take off work for any type of restorative care. Now, we consider those prime time hours to be before 9 a.m., after 5 p.m., and any weekend hours. So over here on the left-hand side, we have a current schedule that I see many dentists keeping, which is their office is open from 8 in the morning till 5 p.m., Monday through Thursday. And so with this schedule, you can see here they're only covering one of those prime time hours, which is the preferred time that our patients want to come in and get their teeth cleaned and have their hygiene visits. Well, they have the potential, if they were to open from 7 in the morning till 7 at night, every day they would add 3 hours of prime time hours every day, Monday through Thursday. And if they were open on Friday, they would add 4 prime time hours. And then if they were to open on a Saturday, then they would add 12 prime time hours. And by prime time, we mean preferred hours. This is what our patients, your patients, are asking for. Now, I know when you look at that schedule, you think, how are we going to cover that? Do I want to work that much? I'm not talking about any of that right now. We can work that out and we don't have to maybe start with this busy of a schedule, but I just want you to see the potential. By adding these extra hours, we're adding 28 hours a week over here on the right-hand side. Now let's talk about how to translate this into production dollars. This is a very simple methodology, but very predictable and pretty dang accurate as well. So on our input screen here, we're going to notice over here that let's just assume that by adding those hours, we could simply just add 1 extra hygiene patient per hour. And then let's assume that we average between all of those patients, we average $100 for that hygiene visit. Now, this is an interesting number here that we need to look at your practice to understand, but it's a very simple number. We simply take the number of hygiene visits that you do in a month, and we take the total production, collectible production, let me say that, collectible production, reasonably collectible production, and we divide that by the number of hygiene visits. And that will tell us a very simple but accurate number, which is the average restorative revenue or production per hygiene visit. And so we've put $640 in here because that's the average across about 2,000 practices that we have some data on. And so we know that every time somebody comes in, they're worth $640 in restorative care to the practice plus $100 in hygiene revenue. That's just the average. Now, you have to trust that number, right? You have to understand that not everybody is spending $640, but out of 10 patients that come in, 9, let's say, you don't find anything that needs to be done in the mouth, but then the 10th, you find $6,400 worth of work, and they do that and pay for that. So your average over those 10 patients is $640 per hygiene visit. What that does is we're adding 28 hours per week. That multiplied by 4 is 112 primetime hours per month. And then we're just assuming we could add 1 patient per hour. Now, if you have 3 hygiene chairs, or if you have maybe 6 total chairs and you want to do hygiene out of all of those during primetime hours, we can talk about those strategies. But right now we're just saying if you just added 1 patient, hygiene patient in those hours, that would be 112 new hygiene visits for the month. Let's add this all together. That would equal $2,800 in just hygiene revenue. Remember that $100 fee that we collected? Just the hygiene revenue, that would add $2,800 per week, $11,200 per month, or an extra $134,000 per year. But if we collected $640 per hygiene visit, that would add over here $71,680 per month in production. That's a potential of $860,000 per year. Add those two numbers together, which is restorative care revenue, dental procedure revenue, plus hygiene revenue. That's $994,000, almost $1 million, simply by adding and giving the patient what they want and only getting 1 new patient through hygiene. Very predictable. So if you want to grow your practice, you need to grow the hygiene department. Now, a lot of dentists will say, yeah, we want to grow the hygiene department, and they're only looking at this hygiene revenue, the revenue that they actually get for the hygienist, doing the pro fee, doing the cleaning. But what they're missing is that every time that patient comes in, they have the potential, the dentist has the potential to go in and do an exam and to look in that mouth and find potential work that needs to be done. So the value in the hygiene visit is not just the hygiene revenue. The value is in all of the potential work that you could find by having those people in. So if you understand this model, what you really need to focus on and build on, the one thing is number of hygiene visits, increasing hygiene visits, tracking hygiene visits, setting a hygiene visit goal, writing that goal on a board, giving bonuses to your staff based on hitting certain goals on number of hygiene visits. Because what we do know, what we have seen over and over again in dental practices is that you get your number of hygiene visits up, everything else takes care of itself. If it doesn't, then there's other problems we need to diagnose. Maybe we're underdiagnosing, maybe our treatment presentation is not where it needs to be. All of those things that we can handle. But the one thing that we have to have is we have to have butts in the chair. Because every time a patient sits in, it's worth $640 to the practice. Listen, tracking your number of hygiene visits and your production per hygiene visit is critical to your dental practice. It's also very predictable and gives you a systematic approach to reaching your practice's full potential. We just saw an extra $1 million based on this methodology. If you'd like to learn more about this methodology, to have us do an assessment on your practice and look at your numbers specifically and help you put a plan together to grow your number one asset, which is your practice, while integrating that asset with all of your other assets so that your future is secure, please click on the Show More tab below this video and get on my calendar. Click the link, pick a time that works for you, and we'll get on a call and talk through all of these things. As always, if you like this video, please subscribe and also hit the notification bell so that you'll be notified when I post new videos.